All right. Welcome, everyone. Thank you all for being here today. My name is Chuck Warpehoski. I serve as the project director for the Michigan Collaborative to End Mass Incarceration. We are a statewide network of advocacy organizations, direct service providers, faith-based leaders, business organizations, and others who all believe that we can have a safer Michigan while reducing the Michigan prison population through smart policies related to preventing crime and incarceration, reducing excessive sentencing, improving access to rehabilitative activities, and supporting reentry in the state of Michigan. We also convene the Investing in a Safer Michigan Coalition, which is what we are here today to talk about. There's been a lot of coverage lately regarding the potential of a state government shutdown, and I understand that. That's an exciting event. It's not the way business is normally done, and it's an entirely manufactured crisis. We're not facing any fiscal cliff like we did with previous shutdowns, but we're facing this manufactured crisis. And what's been lost in the coverage of this potential government shutdown and the budget debate is what the actual policy priorities are on the table and how they would affect Michiganders. We are especially concerned about how the House budget would potentially cut a lot of important protections from uh, violence prevention, rehabilitation, and reentry services that keep Michiganders safe. So today we'll be discussing three of these issues, and we've got a great panel lined up. We are anticipating that Sierra Renee from Force Detroit will be joining us. Force Detroit is a state and national leader on community violence intervention. They're doing amazing work in the city of Detroit to prevent violence and homicides, and doing amazing work statewide and nationally to make sure there is adequate funding for these life-saving community service, community safety investments. We also have Hakim Crampton from Citizens for Prison Reform talking about the importance of adequate funding for healthcare and nutrition while people are incarcerated, and how this is actually something that all Michiganders should care about, whether or not you have a loved one who is currently incarcerated. Also with us today is Jonathan Garcia from Nation Outside, Michigan's leading peer-led reentry provider, talking about how important funding reentry services post-incarceration is for public safety, for our economic well-being, and especially the role of peer reentry services like Nation Outside provides. I'll wrap it up with a little bit of a discussion around how we can, with a smart investment now, have a safer Michigan and reduce our prison spending long term by funding the bipartisan uh, sentencing commission that was passed last year. So, with that, I'm going to let Hakim Crampton from Michigan Citizens for Prison Reform start things off. Hakim, take it away.
Thank you. Thank you, Chuck. Appreciate that. Appreciate all of you for attending this important conversation. And this is an important conversation today. And it's a conversation about community. And at the center of community is the crossroads of both public safety and the system that we create called incarceration and its legal process, and how that ultimately affects our communities that we all come from. And so, for rehabilitation, of course, is the ultimate goal of incarceration, and the outcome is therefore public safety. So, we as Citizens for Prison Reform, we support continued funding and increases to funding for expanding healthcare and quality food access to persons that are incarcerated. As we know that diabetes and hypertension are two of the most highest prevalence of ailments that occur while inside incarceration. We believe that access to quality food and healthcare are important to rehabilitation, reducing costs to medical care while incarcerated, and the ultimate later cost to Medicaid post-release. Eliminating copays while people are incarcerated increases an incentive to get routine health checks that, if not diagnosed early, would ultimately increase costs to the state for care that should have been and could have been preventable. We also believe that access to essential evidence-based program and treatment services creates a successful pathway towards reentry, and reentry is the ultimate goal for a successful, safe public society. Therefore, if the Department of Corrections and our legislature would prioritize rehabilitation, we understand that healthcare expansion, including access to mental health services and essential educational vocational programming, that these things could create a greater chance for successful reentry back in our communities. So at Citizens for Prison Reform, we are calling upon and urging our state's legislature to prioritize rehabilitation over punishment and help us create a healthier and safer community in our society. So once again, thank you for attending this press briefing.
Thank you, Hakim. And as Hakim lifted up, the current programming, food, and healthcare services provided in Michigan Department of Corrections are currently inadequate. They are not serving the needs of incarcerated people, their families, and our communities. And in that context, the proposed House budget cuts, cutting an um, additional funds from both of those budgets is particularly dangerous. We're looking at almost $3 million cut from the food budget and approximately $13 million cut from the healthcare budget. While our focus is on the well-being of incarcerated people, their families, and communities, the risk to the food budget is an added danger because of how it could create further dangerous conditions in our understaffed prisons. This is something that really affects everybody. I'm really grateful for the leadership that's Hakim and Citizens for Prison Reform show on this issue. Next up, we have Jonathan Garcia from Nation Outside talking about the importance of reentry services.
Good afternoon. As Chuck alluded to, my name is Jonathan Garcia, and I am with Nation Outside. Um, as you guys know, every year thousands of Michiganders return home from prison. And for them, reentry is not just about walking out of the gates, but it's about finding a fair chance to rebuild their lives, reconnect with their families, and contribute positively to their communities. Without support, especially reentry support, the barriers are oftentimes steep. But with the right support, reentry becomes a story of accountability, safety, and hope. At Nation Outside, that's kind of exactly what we've been doing in terms of service delivery. Over the past 15 months, we've served more than 2,200 returning citizens across the state of Michigan, delivering over 18,000 hours, of billable services. Everything from group and individual sessions to pro-social events to rides to ensure that these individuals are safely making it home from prison, reporting to the parole officers, getting them to work, and so much more. As a result, these results from our program specifically speak for themselves. 97% of participants have avoided reincarceration, and that's just not a statistic. That's thousands of parents that are now home with their children, thousands of sons and daughters that are back with their families, and thousands of neighbors contributing to safer communities. And beyond that, in which something I would like to kind of highlight, is the fiscal impact of programs like ours. With incarceration cost at nearly $50,000 per year per person, our success rate has already saved the state of Michigan more than $40 million in taxpayers' money. On top of that, by providing over 4,600 hours of safe day of release prison transports, we've saved the Department of Corrections, as of today, $373,000 in direct cost. But it goes beyond money, because with our ability to transport individuals on the day they're released, we're allowing correctional officers to remain on site and keep our prisons safe during staffing shortages. But the numbers only tell a part of the story. This work matters because it's peer-led. Our peer navigators are all formerly incarcerated individuals themselves. They know the road, they have built trust, and they have modeled accountability, guiding others to follow through on parole plans, stay engaged, and stand tall in their commitments. Every successful reentry makes Michigan stronger. It means fewer crimes, fewer victims, and safer neighborhoods. It means families reunited instead of broken apart. It means taxpayer dollars spent wisely on proven outcomes instead of repeated failures. Nation Outside is not a pilot. It is a proven statewide solution. From Wayne County to Kalamazoo, from Oakland to Genesee, our impact is real, it's measurable, and it's scalable. So today I ask everybody who is here, community members, legislators, partners, to continue investing in reentry, because when returning citizens succeed, Michigan succeeds. Together we can prove that second chances aren't just possible, they're powerful. Thank you.
Thank you, Jonathan, and thank you for the amazing work Nation Outside does to help people return to community and to keep our communities safe. Again, in the context of the state budget, the proposed $8 million that are cut from reentry services in the House budget is a particular danger. Sierra Renee was not able to make it today. One of the things about community violence intervention is they are the ones who stand up when there's a crisis, when there are people at risk of violence, and they're the ones that make the connections to help prevent a violent event from taking place that nobody else can do. Their role is different than law enforcement, and that means they sometimes need to respond at a moment's notice. So we are sorry that Sierra Renee from Force Detroit could not be here with today's conversation, but the issue that Force Detroit brings to the fore is still very important. Right now, Detroit is having the lowest violent crime numbers they've had since I've been alive, and even before that. This has been the result of a multi-pronged effort that a key portion of that was preventing violence before it happens through the use of trusted messengers. Folks who are in the community have the relationships with people who are at risk of committing violence and can head that off before there are shots fired. It is essential work that law enforcement can't do. Other community agencies can't do. It needs to be people who are trusted in the community and have a non-law enforcement relationship. And that's exactly what Force Detroit and their community violence intervention partners are doing across the state of Michigan. Jonathan talked about how the reentry support that Nation Outside provides is proven to improve outcomes. The same is true for community violence intervention. This is a vital investment that keeps Michiganders safe. Unfortunately, the funding for these vital services has been threatened. We don't have our other community safety services like our hospitals, our EMS providers, or our firefighters worrying if they're going to get funded in the next budget cycle, but community violence intervention professionals are. The governor's budget holds the community violence intervention state funding at roughly flat at about $5 million of total funding. The Senate budget proposes increasing that to $125 million. That would include, and after the shooting death in Colorado last week, we were reminded of how important the school-based violence prevention work is. And so that's something that's in the Senate budget. But the House budget cuts our state investment into community violence intervention down to $1.5 million and eliminates the State Office of Community Violence Intervention. This state office is especially important because as more and more communities are working to develop these proven strategies to keep Michiganders safe, there needs to be a state organization that can help provide the leadership development, technical assistance, and funding support so that groups can go from a good idea to effective implementation. Again, this is a case where the state House budget puts Michiganders at risk by cutting vital violence prevention services. Now, in all of this, a lot of the talk around the budget crisis has focused on a false choice between dangerous spending cuts and potentially painful increases to state revenue. This is a false dichotomy. There are ways that we can safely and effectively reduce the cost of incarceration without putting incarcerated people, families, and communities at risk. Michigan's prisons are a good example of this. Many folks who are in prison don't need to be there. They've grown up, they've aged out, they're too old for this stuff, or they've had a rehabilitative experience while they've been incarcerated and are committed to not continuing with the kinds of mistakes that landed them in prison in the first place. When we keep somebody in prison past the point of rehabilitation, rather than improving public safety, we are only wasting public resources that could be better spent on prevention, reentry, and rehabilitation. Unfortunately, Michigan's sentencing guidelines were created by the same dysfunctional political gamesmanship that have brought us to the current budget crisis. And so there is a solution. Last year, the legislature passed the Bipartisan Sentencing Commission so that we could get stakeholders, including victims, including prosecutors, including formerly incarcerated individuals, in the room together with the data, with the experts, to carefully review our sentencing guidelines and make sure they're in that Goldilocks zone. Not too loose to to create a risk to the public, not too strict that we're wasting lives and wasting taxpayer dollars on unnecessary incarceration. A small investment, as the Senate had done in this sentencing commission now, can produce long-term savings for taxpayers and improvements in public safety by making sure we dial in and use data, evidence, and best practices to make sure Michigan's sentencing framework is adequate to promote public safety. So lawmakers have a choice. The governor, Senate Majority Leader Winnie Brinks, State Speaker of the House Matt Hall have a choice as they finalize their budget negotiations. Will they follow the course that the state House budget has put forward and put Michiganders at risk by cutting vital investments to prevention, rehabilitation, and reentry, or will they invest in the programs that make Michigan safe? We obviously hope that they will invest in a safer Michigan and support the kinds of programs that Hakim, Jonathan, and other my Senate members are supporting. With that, we have a moment in case there are any questions from anybody in the audience.
Hey, thanks so much for holding this press conference. My biggest question is just why is the progress on your funding? What's the reason for the disparity between the Senate and the House? Why is it at risk in the House being slashed?
Thank you. So I will take that, and then if there's anybody else from the panel, make sure you get a chance. I will ask that if any of the other speakers want a chance, make sure we get the highlights to you so anybody who's recording for video gets good video on that. So we are Michigan's budget requires all three branches of government to agree. We need the state Senate, we need the state House, and we need the governor to all find a compromise agreement. The reason we've been focusing on the dangerous cuts to the House budget, our goal is improved funding for all of these services that address rehabilitation, reentry, and prevention. We are terrified, quite frankly, of what the impact of the state House would be, and that fear is a driver. We also know that if the House chooses to be a good negotiating partner, we think a lot of these can get worked out. If all three branches choose to be good negotiating partners, these can get worked out. And there is a risk that any one organization holding out and drawing a line on any of these items could put Michiganders at risk. So we want a compromise budget that addresses public safety through reinvestment in prevention, reentry, and rehabilitation, and we're hoping we can get there. Hakim or Jonathan, did you have anything to add to that? All right. Thank you for your question, Peter. Lisa.
Thank you for taking my question. This is Lisa with MERS News, and I just have a couple questions. You indicated that there are ways to safely and effectively reduce the cost of incarceration without putting people at risk. Can you be more specific about those ways?
Thank you, Lisa. So when you look at the data about recidivism across the nation and especially in Michigan, you see that there are certain populations that have very low recidivism risks. In particular, people who have already served over 20 years in incarceration or who are age 50 and above, their risk of recidivism is about at the same level as the population as a whole. And yet Michigan keeps many of these people in prison, and the cost of incarceration for them is high. As people age and our prisons look more and more like low-quality nursing homes, the cost of that care and incarceration is extremely high without producing any public safety benefit. I'd encourage folks to visit if they can, to visit the geriatric facility at Coldwater Prison. These folks are in wheelchairs and walkers, and they're not going to chase you down the block to get your wallet. They would be safely able to return. The reason we can safely reduce our prison population is if we were to look at the data and look at the individual cases, we would be able to identify who are the people who, from a public safety perspective, incarceration makes sense from a data and an analytical framework, and who are the people who could be safely released. The Sentencing Commission is the vehicle to start to do that review of our sentencing guidelines. And by investing in this and right-sizing our sentencing guidelines and helping the people who are no longer a risk to public safety come home, that's how we free up more money. And that's also, that money can then go into other violence prevention efforts. As an added benefit, as many of you know, Michigan is facing a staffing crisis in our prisons that puts everybody at risk, the corrections officers, the incarcerated people, and the folks coming home if somebody has had a traumatic prison experience rather than a rehabilitative one. So reducing our prison population safely also helps address our staffing crisis. I see Hakim had something to add. Let me switch to you, Hakim, and you can add in.
Yes, thank you. And that's an important question because I think that there is an additional point to consider. You know, we see that when it comes to recidivism directly points to the state or quality of our public safety. And so if we have people who are filtering in and out of prisons and are constantly returning to prison, we know that that's creating a public safety situation in our communities. But what we're finding is that people that aren't recidivating, what is their track record saying to them? What it's showing is that while they were incarcerated, these are people who attended programming while they were incarcerated, got access to vocational or education or even higher education, or people who participated in other forms of treatment services that actually directly benefited them so that they were more equipped mentally and socially to return back to society. That's where the investment needs to be replaced at. The investment needs to be focused clearly on programming and treatment services that actually benefit people, because this is the crisis that we're at, what Chuck talked about, the staff crisis, the staff shortage, and the overall volatility of what's happening inside the prison system. And the MCO, the Michigan Corrections Union organization, just recently released a report about the level of violence. Well, let me put it this way quite clearly. This is important to take into consideration. We are prioritizing people that are about to be released within a short period of time for program treatment services. That means that for a huge segment of the prison population, we have people in prison who are going to be there for 10, for 20, some are even going to be there for 30 years before they're considered to be released, but they will be returning back to our society. We simply don't prioritize them for services, for treatment. Some of them are incarcerated for very violent, aggressive behavior, and they're not prioritized for mental health treatment services during that next 10 to 15 years. They're not prioritized for their educational services, the vocational services, things that help in their maturation of who they develop to be, the adults that they become. If they're allowed to persist inside prison and jail with no treatment, no services, no engagement, they are likely to be the ones that create a worse environment for our staff to work within. So it's important that we understand the value of programs and treatment services, but also the prioritization of when we provide those treatment services to adequately prep people for successful return. So we're identifying programs and treatment services that actually work, that are educational, vocational based, that are employment based, that prep people, mentally based, that prep people to undergo the services and treatment they need to be successful.
I appreciate that. May I ask a follow-up question? You also said something about unnecessary incarceration. Is that the group you discussed earlier, those inmates in the wheelchairs, those who are elderly, that population?
Yeah,
Go ahead.
thank you for that question, Lisa. I'm going to try to pull up. Rick Snyder had a great quote on this when he was governor. That was that anybody who is held in prison beyond the time at which they have rehabilitated and are safe to come home, that excess incarceration is essentially a theft of taxpayer dollars that could better go into other services. So our coalition involves a wide variety of perspectives about the role and scale of incarceration in the state of Michigan. And different people have different degrees on how big incarceration system should be, but we all recognize, based on the data and based on our experience meeting some of the people who are either currently incarcerated or who are formerly incarcerated, like Mr. Crampton and Jonathan here, that yes, there are people who have rehabilitated who are no longer a threat to public safety and who could be safely released. And those are the ones that we are looking at in the budget. addressing the sentencing commission as a way to make sure that we do not have a sentencing framework that creates excessive incarceration for new people coming into the system. And there are long-term policy conversations we have for people who are currently in prison and who are no longer a threat to public safety and could be released. But that's beyond the scope of the budget for this year.
Isn't safe to come home though subjective?
Correct. There's no framework that we can have ahead of time at the time of sentencing to know who somebody will be in 10, 20, 30, or 40 years. Michigan has a system that's called indeterminate sentencing. So the judge with the sentencing guidelines sets the minimum sentence, and then the legislature through the statute sets the maximum sentence. And then it's the parole board's job using a variety of tools to assess somebody's readiness to come home. The process of setting what that maximum sentence is and what the minimum recommended sentence in the sentencing guidelines is a legislative process, and it has been driven not by data, not by best practices, not by thoughtful engagement with all stakeholders, but it's been driven by the same kind of political gamesmanship that we're seeing this year with the budget fight. So our request for the budget is to invest in a process to look thoughtfully at that spending, at those sentencing guidelines, so that we are able to get a sentencing framework that's data driven. And again, my goal is that Goldilocks sentencing framework where it's neither too loose and puts people at risk, but also not too strict where we're wasting taxpayer dollars, destroying communities, and harming lives.
So in an ideal world, what's the budget that you all would like to see?
In the short term, there are parts that we like in all three budgets. We do appreciate in the House budget the additional funding for the resentencing of juvenile lifers and emerging adults who are up for resentencing based on Supreme Court cases. There are parts of the Senate budget that we like, especially the added funding for community violence intervention. There are parts of the governor's budget that we like, especially the added funding for rehabilitative and reentry services. In the short term, what we want is a budget compromise that maintains the funding at least or extends it in these three areas: prevention, rehabilitation, and reentry. Long term, to address the staffing crisis and the effects of the big beautiful bill and other things, we need a thoughtful review of how our prison staffing is going to be. That's a process. The Sentencing Commission is a part of that process, and that's why we're saying start there with the corrections budget. Hakim or Jonathan, is there anything you'd like to add into that? And so one last piece, Lisa, and then I see Peter. This is also why anytime we're dealing with the prison system, things have already gotten too far. And that's why the efforts of Force Detroit and other community violence intervention programs across the state, so that it doesn't even become an issue that police or prisons or the courts need to deal with because we prevent it at the front end, is so important. And that's part of how we reduce our prison population, is by preventing crimes and violence in the first place. And Force Detroit's doing amazing work at that. Peter.
Thank you. Those were my questions.
Yeah, my last one here. Are there any particular lawmakers, either in the House and Senate, that you're working with in particular, especially in West Michigan, to kind of advance these legislative goals?
So in West Michigan, the chair of the House Corrections Subcommittee is Bradley Slaw. He's been a very thoughtful leader on these issues. I'll be honest, while there's a lot in the corrections budget we don't like, I was bracing myself for something much worse. And I think it's Representative Slaw's leadership there that's helped maintain some of these services. So across the different issues that we're working on, different members of the coalition are working with different leaders on different parts. But a lot of our issues are dealing with the corrections budget. So it's Representative Slaw in the House and Senator Schenck in the Senate. And then obviously the appropriations chairs, Sarah Anthony and Ann Bolin, are the other leaders there below the Senate. And obviously, on the west side of Michigan, Senator Majority Leader Winnie Brinks is one of the key negotiators for the final budget. Any further questions? Jonathan or Hakim, do you have any final comments before we wrap up? All right. Well, that concludes our press conference today. Thank you so much for your attendance. Thank you so much for your great questions. And we do hope that as the budget moves from the political posturing to the final budget negotiations, cooler heads will prevail, and we will have a state budget that invests in these services that keep Michiganders safe: violence prevention, rehabilitation for people incarcerated, and reentry services so people succeed and give back post-incarceration. Thank you all for your time.
Thank you.